Hello everyone, welcome to Bangor University's MSc in Counseling Research Conference. Thank you for joining us today. I'm Maybel Shajan and I will be presenting my research dissertation on therapist burnout, spirituality and self-compassion in the COVID-19 era. If you would like to have a handout for this research presentation, kindly email me on my email address given in the description below and I'll be happy to send you the same. In this research presentation, I will first introduce you to my topic of interest and the past research around it. Then I will explain the methods followed by the current study, followed by the results. I will then discuss the research findings and end with the implications of the study and the potential avenues for future research to explore. The coronavirus COVID-19 outbreak has impacted every echelon of our society. In addition to physical health and economic repercussions, nations were being confronted with acute psychological consequences of this pandemic. The World Health Organization in 2020 reported an increase in hopelessness, demotivation, maladaptive coping, and stress leading to pandemic fatigue during the COVID-19 outbreak. The National Health Service Reset Report in 2020 stated that although at the beginning of the COVID-19 outbreak, the demand for counseling services dipped by 30 to 40%, pandemic-related mental health crises increased after the initial few months. Therapists were required to cope with personal challenges amidst the pandemic, alongside bracing themselves for a tidal wave of professional demands to be met, all in a short amount of time. The amalgamation of personal and professional concerns that the global pandemic presented to mental health practitioners can be detrimental to their well-being, making them susceptible to burnout. Burnout is defined as the prolonged physical and psychological exhaustion, and it can be experienced in personal, work-related, and client-related aspects of therapists' lives. The job demand resource theory predicts that there will be high burnout and work-related stress for professionals, high on job demands and low on job positives. During the pandemic, therapists were found to have witnessed higher job demands, such as case overload, lack of a conducive workplace, boundary disturbances, inadequate skill training, and technological barriers, while experiencing reduced job positives, such as support from colleagues and opportunities for professional growth. Researchers found that the shift in remote therapy was beneficial for many clients and therapists, but it also came with the additional pressure of learning to adapt to a new form of communication, both for the clients as well as the therapists. Now, with cultural diversity factoring into therapy, spirituality has been explored as a powerful protective factor. Underwood in 2011 in their paper defines spirituality as the awareness and connection to the divine and the inclusion of a spiritual or religious perspective in daily life experiences. Wachholz and Rogoff in 2013 found an inverse association between spirituality and psychological distress in medical students. Researchers also indicated that spirituality worked as a protective element essential in mitigating burnout in psychologists. Now, spiritual care provided to patients amongst COVID-19 in a study showed that it increased their hope and coping skills to face this adversity. Research also found a promising effect of religious or spiritual coping on COVID-19 related fear, anxiety, and depression amongst healthcare workers. Often closely studied with spirituality is self-compassion, which can be described as the ability to be kind, warm, mindful, and non-judgmental towards oneself, especially in the times of sufferings and difficulties. Spirituality and self-compassion have been found to share certain values such as kindness, a non-judgmental attitude, and the common belief in humanity. Self-compassion was found to be strong in care workers and medical professionals who identified as spiritual. Atkinson et al. In 2017 focused on mental health staff who were working with war veterans and found significantly inverse correlation between their self-compassion and the burnout that the staff experienced. Training programs focused for psychologists to develop their mindful self-compassion were able to observe a noticeable decrease in stress and burnout in those psychologists. Studies have found self-compassion to be an effective contributor to the self-care of counselors, helping them avoid possible effects of distress, and it can also act as a buffer against mental health concerns during COVID-19. Now, based on previous research, my study aimed at investigating if there was a significant relationship between burnout, spirituality, and self-compassion in therapists who specifically worked with clients during the COVID-19 period. Following this, my study looked at three main hypotheses. First, that there will be a negative correlation between personal burnout and spirituality. Negative correlation between work-related burnout and spirituality, and negative correlation between client-related burnout and spirituality. Second, that there will be a negative correlation between personal burnout and self-compassion, a negative correlation between work-related burnout and self-compassion, and a negative correlation between client-related burnout and self-compassion. The third hypothesis being that there will be a positive correlation between spirituality and self-compassion. The current study had ethical approval from the Bangor University Ethics Committee. To partake in the study, participants had to be about 18 years of age and be counsellors or psychotherapists working in the UK during the COVID-19 period. Participants must have had worked with clients for at least 4 months prior to filling in the survey. Being a member of a relevant professional therapeutic body such as BACP, UKCP, or NCS was desirable. Participants who were in practice for less than 4 months were excluded from the study. There was no exclusion criteria with regards to nationality, ethnicity, or gender. Data was collected using the snowball sampling method, and for the final analysis, responses from 84 participants were taken into consideration. This empirical study utilized a correlational research design with 3 main covariables. The first covariable was burnout, divided into personal burnout, work-related burnout, and client-related burnout. The second covariable was spirituality, and the third covariable was self-compassion. There were 3 measures used in this study. Burnout, which had 3 subsections, personal, work-related, and client-related burnout, were measured by separate scores on the Copenhagen Burnout Inventory by Christensen et al. Spirituality scores were measured by the Daily Spiritual Experience Scale by Underwood, and the short form of the self-compassion scale by Rice et al. Was used to measure self-compassion. Participants accessed the online questionnaire through a link provided during recruitment. All participants who consented to being a part of the study were asked demographic questions as well as questions regarding their professional practice, such as time they had contributed to client work during the COVID-19 period and their qualifications. Participants then answered the questions on the 3 scales, at the end of which they were debriefed about the purpose of the study and signposted to any additional support in case it was required. Now let us look at the research findings of this study. The final analysis utilized data obtained from responses of 84 therapists. The average age of these participants were 40.35 years, and 81.9% of the participants were women. More than 76% of these therapists had received some level of training in taking remote therapy sessions. Although 56.4% of participants identified as religious, only 3.6% said that they felt close to God as possible. 40.5% of the participants denied feeling close to God. The average score for personal burnout was the highest with a mean of 48.81, followed by that for work-related burnout at 39.29, and the average score for client-related burnout was the lowest at 20.34. The mean on spirituality was a low of 2.97, while the mean on self-compassion was a moderate 3.24. Parametric statistics was used for the final analysis of data. Pearson's correlation was applied to determine the relationship between all variables in the study. For the first hypothesis, analysis of personal burnout and spirituality showed that there was a negative relationship but no statistical significance in the relation between these variables. Between work-related burnout and spirituality, there was a negative relation, but again, not a significant one. An analysis between client-related burnout and spirituality again showed no significant relationship. Interestingly, in the second hypothesis, there was a statistically significant negative relationship established between personal burnout and self-compassion, a statistically significant negative relationship between work-related burnout and self-compassion, and a statistically significant negative relationship between client-related burnout and self-compassion. For the third hypothesis, no statistically significant relationship was established between spirituality and self-compassion. Data obtained by this study indicates that it was not in line with the first hypothesis. A possible explanation for this could be that with the advent of COVID-19 and based on the NHS Reset report in 2020, which predicted a surge in demand for counseling, therapists may have relied on external support. They could have taken precautionary measures like accessing additional supervision, managing caseload, and engaging in peer support to ensure work-related and client-related burnout was addressed. While on the other hand, weightage given to spirituality in their lives may not have been as significant as predicted, which can be substantiated as very few participants in this study indicated feeling close to God. A global pandemic could have also meant that, for many therapists, their relationship with God may have been impacted, and the meaning given to the spiritual aspect of their lives may have been significantly declined. Studies have found that spirituality may not be categorical in nature, but more fluid and personal, where values of gratitude, acceptance, and assurance may be more strongly linked to spirituality than a connection with God. Therapists who find their work to be their passion may find meaning and value in the client work they do, and might not really look up to spirituality to provide for that sense of purpose. The present participant sample also consisted of more therapists from a higher age range, for whom spirituality may be more associated with religious beliefs and traditions. These values, which may be deeply rooted in the traditional understanding of relationship with God, could act as unmanageable expectations for many individuals, rather than a support system. Therefore, spirituality quantified by this measure, DSES, might be perceived as religiosity, and that may not be essential to therapists in their daily life. Data collected by the study was found to be in line with the second hypothesis. Self-compassion has been studied to provide coping against work stressors that consequentially lead to emotional exhaustion, which is a primary definer of work burnout in professionals with high-demand jobs. This could explain the strong relationship found between the three subsections of burnout and self-compassion. The principles of self-compassion, such as mindfulness and finding commonalities in human nature, can help regulate the negative viewpoint that burnout can come with. Studies have shown that in professionals, especially women, who have a supportive workplace that encourage autonomous schedule, have moderate levels of self-compassion. As mentioned earlier, due to the anticipated risk in work demands, therapists may have engaged in personal therapy, drawn stronger boundaries when working from home, and engaged in self-care activities. This could positively contribute towards higher self-compassion and alleviate the effects of COVID-19 related demands that come from being a counselor. Interestingly, data collected indicating therapists' spirituality and self-compassion was not in line with the hypothesis, and no significant association was established. This could be because of the difference in participant samples of this study when compared to the participant samples of past researches. The therapist population may not identify with spirituality as much as general population, as it could mean having strong personal views. Research has found strong personal values carried by therapists can sometimes become detrimental to the therapeutic relationship, as it increases the prevalence of biases and countertransference. Studies show that spiritual individuals are also less likely to seek support and care from external sources, and heavily rely on internal factors like spiritual connection to God. The social mentality theory stated that self-compassion and assurance is only activated when there is a two-way interaction of caregiving and care-seeking with others in a social context. Studies have found that self-compassion was lowest in those who engaged in more caregiving and less care-seeking behaviors. Spiritual therapists in this study may have been more susceptible to high levels of caregiving due to their spiritual values that possess selflessness, but lack in care-seeking, limiting their behavior to only a few internal sources such as spirituality. Now let's look at the implications of the study and what future research can potentially explore. Contrary to past findings, spirituality may not play a protective role for all individuals who identify as spiritual. For therapists working with spiritual individuals, including other therapists who engage in personal therapy themselves, this could mean focusing on individual meaning and significance each person gives to spirituality, while considering if it is different from religiosity for them. Qualitative research can provide further insight into the role of spirituality and the nuances of it for every individual. Self-compassion has a correlation with burnout for therapists, and this could mean that there are elements of self-compassion that has the potential to mitigate burnout. Future research can focus on causational relationship between these two. A study looking at the causational relationship between burnout, spirituality, and self-compassion can be significant. The impact of COVID-19 cannot be sidelined, as current research has found contradictory findings to pre-COVID studies. Further, longitudinal studies can be beneficial to see if results remain the same. Research can also explore if therapists' preparedness for the potential rise in demand for mental health support helped in mitigating any negative impact of this global pandemic. See, here's a take-home message, especially for therapists currently working in this field. Consider encouraging and nurturing self-compassion, not just for your clients, but also for yourselves, as it has been found to have an inverse relationship with personal burnout, work-related burnout, and client-related burnout, even during a global pandemic that saw a rise in job demands for mental health professionals. Thank you for your interest. If you have any questions, please feel free to ask in the comment section, or you could email me on my email address given in the description below.